Welcome back to our channel. With Ramadan just around the corner, it's important for people with diabetes to be aware of the potential risks during fasting. In this podcast, we'll be discussing some of the increased risks for people with diabetes who will fast during Ramadan. The following risks are increased during Ramadan for people with diabetes: dehydration, hypotension and falls, thrombosis, hypoglycemia, hyperglycemia, and diabetic ketoacidosis. Dehydration is a common risk during Ramadan as fasting can lead to a lack of fluids in the body. This can also lead to other risks such as thrombosis, hypotension, and falls. It's important to stay hydrated during non-fasting hours and to consume plenty of water and other fluids. Hypotension, also known as low blood pressure, is a condition where the blood pressure drops below normal levels. This can occur when the body is dehydrated and can lead to symptoms such as lightheadedness, fainting, and falls. Falls can be a serious risk for people with diabetes during Ramadan as they can lead to serious injuries such as fractures and head injuries. Dehydration and hypotension can increase the risk of falls, but there are steps that people with diabetes can take to prevent them. To prevent dehydration, people with diabetes should drink plenty of fluids during non-fasting hours, especially water and sugar-free drinks. They should also avoid consuming large amounts of caffeinated or sugary drinks as these can dehydrate the body further. Another risk important to discuss is thrombosis. Thrombosis is a medical condition that occurs when a blood clot forms in a blood vessel, obstructing the flow of blood. In the context of fasting during Ramadan, dehydration can increase the risk of thrombosis for people with diabetes. When the body is dehydrated, blood becomes thicker and more viscous, increasing the risk of blood clots. Thrombosis can be particularly dangerous when it occurs in deep veins, such as those in the legs or pelvis. This type of thrombosis is known as deep vein thrombosis and can lead to serious complications, such as pulmonary embolism, which occurs when a blood clot in the veins breaks free and travels to the lungs, blocking blood flow and potentially causing severe damage. Symptoms of DVT can include swelling, pain, and tenderness in the affected leg, as well as redness or warmth in the affected leg. If you experience any of these symptoms, it's important to seek medical attention immediately. To reduce the risk of thrombosis during Ramadan, best thing is to stay hydrated and avoid prolonged periods of sitting or standing. Taking breaks to move around and stretch can also help promote healthy blood flow. If you have a history of thrombosis or are otherwise at increased risk, it's important to discuss your fasting plans with your healthcare provider to ensure that you are taking all necessary precautions to protect your health. Hypoglycemia, also known as low blood sugar, is a common risk for people with diabetes during Ramadan. This occurs when the level of glucose in the blood drops below normal levels, which can cause a range of symptoms, including weakness, dizziness, confusion, shakiness, and even loss of consciousness. During fasting, hypoglycemia can occur due to a lack of food intake or medication like insulin. People with diabetes who are fasting should take extra care to monitor their blood sugar levels regularly and adjust their medication or insulin regimen in consultation with their healthcare provider to avoid hypoglycemia. It is important to listen to your body during Ramadan, especially if you have diabetes. If you experience any symptoms such as dizziness, confusion, or sweating, it's crucial to stop what you're doing and check your blood glucose levels. You can do this by using a finger prick test. If your blood glucose is less than 4 mol per liter, it's important to treat it right away. Don't hesitate to take a break and nourish your body if you need to. Remember, your health comes first. It's important to note that the symptoms of hypoglycemia can vary between individuals, and some people may not experience symptoms even when their blood sugar levels are low. This is known as hypoglycemia unawareness and can be particularly dangerous as it may prevent the person from taking necessary action to address low blood sugar levels. To reduce the risk of hypoglycemia during Ramadan, it is important to eat balanced meals during non-fasting hours that include complex carbohydrates, protein, and healthy fats. This can help regulate blood sugar levels and prevent spikes and drops. Additionally, they should avoid skipping meals, especially at sahur, and should make sure to break their fast with a healthy meal. In the event of hypoglycemia, a person with diabetes should have a plan in place to address the situation. This may include carrying a source of fast-acting glucose, such as glucose tablets or a sugary drink, and having a support system in place to help them if they need it. Overall, hypoglycemia can be managed effectively. It's important to work with your healthcare provider to develop a plan to prevent or reduce the risk of hypoglycemia. This may include adjusting the dose or timing of medications. Hyperglycemia, also known as high blood sugar, is another common risk for people with diabetes fasting during Ramadan. This occurs when the level of glucose in the blood rises above normal levels, which can cause a range of symptoms, including frequent urination, thirst, fatigue, and blurred vision. If your blood glucose level exceeds 16 mol per liter, it may be necessary to consider breaking the fast. It's crucial to listen to your body and take care of your health. During fasting, hyperglycemia can occur due to consuming high carbohydrate meals during non-fasting hours or not taking medications as recommended. Extra care should be taken to monitor their blood sugar levels regularly and adjust their medication or insulin regimen in consultation with their healthcare provider to avoid hyperglycemia. If left untreated, hyperglycemia can lead to serious complications such as diabetic ketoacidosis, a life-threatening condition that occurs when the body breaks down fat for energy instead of glucose, resulting in the buildup of ketones in the blood. To reduce the risk of hyperglycemia during Ramadan, it is important to eat balanced meals during non-fasting hours that include complex carbohydrates, protein, and healthy fats. Additionally, avoid consuming large amounts of high-carbohydrate foods, sugary drinks, and sweets during non-fasting hours. In the event of hypoglycemia, there should be a plan in place to address the situation. This may include adjusting their medication and seeking medical attention if necessary. Overall, hyperglycemia is a serious risk for people with diabetes during Ramadan, but with proper monitoring and planning, it can be managed effectively. It's important to work with your healthcare provider to develop a plan that meets your individual needs. We hope that this video has been helpful in raising awareness about the potential risks for people with diabetes fasting during Ramadan. Remember to stay hydrated, monitor your blood sugar levels regularly, and speak with your healthcare provider about any concerns or necessary adjustments to your medication or insulin regimen. If you found this podcast helpful, don't forget to like and share it with your friends and family. And make sure to subscribe to our channel for more informative content like this. Thank you for watching, and Ramadan Kareem.